Hey guys, I want to talk about the switching that I brought up. It is a little complicated, so I thought I would do a video real quickly on how I do the switch. Now, when I say how I do it, once again, and as I told you in class, this is my best way that I feel that I can clear out a lot of disorganization so that I can continue to figure out what the patient needs. By no means is it the only way, but I think it's one of the most comprehensive ways that I know how to do it. So there is this thing called neurological disorganization and switching. And the history of it was when people would muscle test, the posture may not correlate with the muscle test. So say I had a high hip, high shoulder, and high head. As an AK doc, I should expect to find a weak glute med on the right side. If I went to that and it tested strong, the other one tested weak, that didn't correlate. So the muscle test didn't correlate with the posture. So it's always good to have two tests. One test will reference the other and see, is this making sense? The body is too dynamic, it's good to have two tests. So they called it switching, and then after time they said, you know what, that doesn't sound great, let's call it neurological disorganization, and now it's in the basic 100-hour class. What I want to do is tell you how to fix it as quickly as possible. By no means is the most comprehensive, but once again, I think it'll get you out of a lot of holes. So when you test switching, there's two kinds of switching that when we use the kidney 27. Is you want to have therapy localization to the K27. So you do it two ways. You either do it contralaterally or you do it ipsilaterally. And it's contralaterally, they found that all schizophrenics will test this way. Doesn't mean you have schizophrenia, but it means that there's a deep switch. And I kind of consider that this may sometimes be under this. So this is more of a deeper problem. As you clear that out, then you want to check ipsilateral. So you always want to start with a K27, across K27. So people in a cross K27, if they walk and come back and you test them, all the muscles that tested strong will test weak momentarily until their body relaxes and comes up. So that's very hard for you to work at in a practical sense in your practice. So what I found, or someone told me, I don't know which, is why don't you just put the patient in a gait position? So you put a block here as the patient's laying supine, and a block here under the shoulder, and then you put them in a gait position. You find out which side will weaken. So say you have a strong quad, leg here, block here, test, it didn't show weak. You just switch the blocks. You should find that weaken with a cross K27. So people who test opposite hand on the opposite K27s will show this pattern. If you find it, you put them in the blocks. They should be universally weak. And then you use the therapy localization to see what makes them strong. Okay? That's how you do it structurally. If you want to get fancy, you can have them go into the emotions as well and check pulse points and figure out which meridian is, and see which meridian makes them strong again. And that is probably the best way that you can look into them biochemically. So you have structure with the TL, you have emotions, check emotions in all these different iterations until it comes out strong, you'll find it. And if you find a meridian, a lot of times you can link the emotion with the theme of the meridian. Depends on what your level is. If you find a pulse point, just use your nutrition that you know about the organ, put on the tongue and see which nutrition pulls them out of it. So that's a good way of going. Now the universal nutrition for all switching is you want to check ribonucleic acid, B12, and folic acid. Okay. Now, this is where you may want to pause for a second, get a pen and paper if you haven't already. All right, now back. Is sometimes it may not show when a patient's using their palms when you do switching. You may have to flip their fingers over and it may show up. Anytime you have to do the dorsum of the hand and body weakens, you put the block just like you would, but one thing you may have to do, and this is more advanced, is when they start to therapy localize and the muscle goes strong, have them bite or open their mouth wide. If the muscle, say they're weak, you have them on blocks, you have them bite, they're therapy localizing the right occiput, and it's strong, and they open their mouth and it's strong, and just relax it strong, you can pretty much take care of that occiput. Sometimes they may therapy localize fine, muscle goes strong, but if they bite, it will weaken. This is one of the little hiccups. So you just continue the therapy localization so that if they touch it, if they bite and open and it still stays strong, you can pretty much count on adjusting that. Okay, that's just the only thing. Now, after that's cleared and you cleared out everything and it's not showing no matter where the hands are, so Fingertips here, palm here, switch, same. You've done 4 iterations. Then you go to ipsilateral. You do the same thing. Dorsum, all those. If, once again, you find ipsilateral, you can use the ocular lock at that level. It won't work really well with the cross K27. You want to think ocular lock and chiasm. Ocular lock is eyes up, double inferior occiput, or it may be an apex posterior sacrum. Eyes down, base posterior sacrum. Eyes straight left is either C2 or L4. Don't forget L4. If they look to the right, right C2, right L4. If they look up and right, right occiput, up and left, left occiput, down and right, right sacrum, down and left, left sacrum. Okay. If they show this pattern, you may once again have to therapy localize with them biting down or opening up. Okay. The other thing, other than ocular lock, check chiasm, which just means check them. No, eyes looking straight ahead, one eye closed. That's called optic chiasm. I showed both classes that. If that shows, you can have them touch with their thumb C1. See which one C1 negates it, and then you adjust and go from there. You can check nutrition in the cross K. So as you get to this, when you get ipsilateral, it's less severe, but you want to check the cross K first. If there's any changes to the dorsum or palmar, check bite and see does the therapy localization, does it stay? If you do an ocular lock and say you have a dorsum connection, they should be biting. So if they look up and right and it strengthens the muscle with the TL, have them bite and open wide. If it remains that way, adjust it. And that's really it. That's just a way of clearing out switching very fast. It seems like it's a lot, but if you keep doing it, you'll get it done in a minute or two. So just keep playing around with it. As students, you should be doing that to everyone at all times. Neurological disorganization is really nothing more than the brain is just being overused so much, and we're using our brains a lot in school and those kind of things. So clear out all the switches. Get everyone in your group doing well. You won't have to study as hard because things are easier to process. You won't feel so overwhelmed. You'll feel better. Check the nutrition. Check ribonucleic acid. Doesn't negate the challenge. If you need ribonucleic acid, take it. It'll help you with your studies. Check B12 and folic acid. If they have B12, make sure the stomach's working well. If they have folic acid, ask them, do they eat green leafy vegetables? If they do, maybe you might need to look at pancreas to help them digest, or just give it to them, make them feel better. So I hope this video helps. Carry on. You're never going to feel 100% certain. All you got to do is just get more comfortable with it, and we'll see you soon.